Hi beauties, welcome to my channel HI Beauty by Yulia. I'm Yulia, and the topic for today is a huge concern for many of you. So I'm going to talk about pigmentation. Because it's such a wide topic, I decided to do two videos for this week and for the next week. So what determines our skin tone is a pigment called melanin. In darker skin tones, sometimes the melanin cells are larger and also a bit more. The melanin that our skin is producing has two main forms. One is called pheomelanin, and this melanin has yellowish red color, while the other pigment is called EU or eumelanin, and this pigment has darker brown color. So you see, if your skin is lighter, pale like me, probably you have much more pheomelanin, which means that your skin will get red when it gets burned. While if your skin is darker tone, usually has eumelanin, which means that that's why your skin is getting brown. Now, keratinocytes are actually the cells that are saying, I feel the UV damage, please help me. So they send signals to the melanocytes to produce more melanin. When this melanin is produced, it goes back to keratinocytes, which were calling for help, and it actually covers their nuclear, so your skin pigment is actually shield against the UV damage. That's why it's so important. Unfortunately, keratinocytes sometimes do hold too much melanin into themselves, and that's why you can see visible difference in your skin tone. But also, sometimes they're just incapable of giving the sort of protection that will actually do the job. And when the UV rays do damage the skin cell's DNA, you might get some mutation or damage of the structure of the DNA. Too much sun exposure might bring us a lot of headaches, but we do need to expose under the sun, because you see, only 10% of our vitamin D comes from fatty fish and egg yolks, so our food. The other 90% is actually synthesized in our skin and kidneys with the help of a chemical and UV light. I will try to explain you about the different types of pigmentation. We call them hyperpigmentation because it means that your skin is getting darker for some reason. Now, the first type is PIH, and that stands for post-inflammatory hyperpigmentation. It's when you have acne, especially with darker toned skin, you are left with dark marks afterwards. So this happens because there was some kind of inflammation into the skin, and it triggers basically the melanocytes to produce more melanin, which stay on the surface of the skin afterwards. Post-inflammatory hyperpigmentation could be appearing on the surface of the skin, which means in the epidermis, but it might actually go as deep as the dermis of the skin. And the reason is because usually it is more superficial, which means that around 30 days when your skin natural turnover appears, the darker skin sheds, and you can see underneath a lighter pigmentation, or even if you're lucky enough, no pigmentation at all, so you can see back your even skin tone. Now the problem is that when the injury is a very serious, the basement membrane of the epidermis is damaged. So some of the melanocytes are able to penetrate deep in the dermis, and therefore it can literally take months and years to heal, and it's very difficult to treat because it is so deep. So when we talk about post-inflammatory hyperpigmentation, you do have to address two issues. It's not just your pigmentation, it's also the inflammation. So if you try to treat it with some kind of very harsh exfoliating ingredients with a lot of actives, you will only aggravate the issue. The second type of hyperpigmentation is called melasma. Usually it is caused by UV damage, but also hormones and genetics. So this doesn't happen only during pregnancy, and although sometimes it does fade away after we finish with breastfeeding, it doesn't necessarily mean that it will be completely gone. So unfortunately, sometimes we have to treat it. And because the problem is internal, it's not so easy to get hand on it and try to control it. Treating just the spot very unlikely will work completely, because very often it is much more spread underneath the surface of the skin. So the fact that the pigmentation is not completely visible for the naked eye doesn't mean that underneath there isn't any damage. The third type of hyperpigmentation is sunspots. They look like freckles, but usually they are larger, and they're caused when the melanocytes went into complete overdrive from the overexposure under UV rays. So in this case, staying away from the sun and sunbaths, and using some kind of protection such as hats, sunglasses, UV protective clothing, SPF should definitely help. Also going for professional treatments and your home care as brightening treatments should also help in this situation. And the last type of concern when we talk about hyperpigmentation are age spots. They're caused by the UVB damage and also from obviously the age. Now they're called sometimes liver spots, although actually our internal organ has nothing to do with this type of issues. So once again, your home care and professional care should improve the situation. When we talk about treating pigmentation, your first line of treatments will be products and ingredients that you can get online or in a drugstore, and this will be your vitamins A, B, C, and some natural ingredients such as licorice. But if this doesn't work, or you want to go straight away to something a little bit stronger, then you do have to see dermatologist, because things like corticosteroids and hydroquinone do have to be prescribed here in UK. And then your third line will be your professional treatments. For those one, you can go to a lot of different places and check them all, but I want to give you a bit of information so that you know what to look. The first group of treatments will be chemical peels. Now, chemical peels are a variety of peels. They have 3 different groups. So they are superficial, medium depth, and deep peels. For deep peels, I'm not going to talk about. They could be done only by doctors and surgeons, and usually they are in hospital because they're high risk and you have to be monitored. So we stay away from those ones. You do have the TCA peels. They are usually between 10 and 25% solution of peel, and at least here in UK, you do need some kind of medical education in order to perform those ones. My personal suggestion is, if you are newbie to chemical peels, to go with superficial peels. Don't go into deep one, because especially if you are with skin of color, the chance of getting some kind of complication is much higher with much stronger peels. So the peels that we are talking about mainly are superficial peels. These are your salicylic acid peels and alpha hydroxy acid peels. And here in UK, your beauty therapist will be the one performing them. Now, when we talk about chemical peels, I do have to highlight that in order to see improvement, you need a course of peel. So checking the price and seeing that it's say £100 or £200 and you think it will work, it will not. You will not see very great results from just one peel. To be honest, you may not even physically peel your skin after one peel if it is superficial. And from this point, you have to understand that you will have to spend more time and money if you will have chemical peels, because you will need at least probably 6 sessions, it might be even 10, and you have to be aware that very unlikely your peel will be exactly the same solution. So if your peel is for pigmentation, that doesn't necessarily mean that, say, you will have lactic acid I don't know, 20% or 30%, and this will be all you will have for all of your pills. Very likely the person who is doing your treatments will monitor you, get the feedback, see the improvement, and then decide. Very likely you will have different strength, or you will stay for a little bit longer period of time, from 5 to 15 minutes with different kinds of solution, in order to see improvement, but in the same time be safe with them. Using the same brand, using the same ingredients as the one that you will get on your face with your professional treatments is a great idea, in order to make sure that you will get a lot of benefits and less irritation. The second line of treatments when we talk about professional care for hyperpigmentation are lasers. There are a few different types of lasers that you can get for hyperpigmentation. The first one is a little bit old school, it's called Endiac laser. Some people do prefer it. Now the second type of laser is Q-switch laser. So it's the same like for tattoo removing, especially when the pigmentation is deeper. It's very difficult to get rid of. Now with this one, it says that it uses low energy, low temperature. But once again, if your skin is darker, you do have to be aware. The third type of laser is called Aeroplace laser. There are a few machines here in UK, but it is not something that is widely available. So you do have to check. They do have a website. You can check for official representatives of the brand. Now with this one, it's a high concentration of laser, but it is for a very short amount of time. So it is considered to be safer for darker skin. Your third option, probably third and fourth, will be your mesotherapist and your microneedling. I am placing them together, although they are not the same thing. So when we talk about mesotherapy, this is injectable. It will be some kind of brightening solution that will be injected into your skin. So this will be performed from a dermatologist or a nurse. When we talk about microneedling, it could be something like derma roller, but it could be something like derma pen, and this can be performed by a beauty therapist. Now I have seen very nice results from this type of treatments for hyperpigmentation. Once again, in these cases, it's very important what kind of solution will be used, because in all the cases, that means that there is direct channel deep into your skin for the solution that will be used, and this will improve very much the penetration of the ingredients of the solution that will be injected, if it's mesotherapy, or just a lotion serum applied when you are having some kind of microneedling. The last course of treatments is actually a topical lotion. Now I am placing this one under professional care, because wherever you live you do need to see dermatologist, or you will have some kind of consultation in a clinic in order to get this product. It's called Cispera, and here in UK it's £140. That's quite of a price. Now I did check, this is not a price that some places did invent it, but you can find it cheaper. Cysteamine was found in the 1960s, but unfortunately up until 2012 we were completely unable to formulate it in order to be stable. In 2019 the product was rebranded into what we know now as Cispera. Now the product is very expensive, but I do have to say it doesn't contain hydroquinone. It is efficient, it is safe, it is considered to be good for even skin of color, so whatever your skin tone is. You should use it for about 4 months, and then you should use it only once a week. Cispera is the only product that contains cysteamine that it is proven that contains this type of ingredients, that it is stable, and it is patented as well. Now there are a lot of dupes popping out for part of this price that are saying that do the same job but are cheaper and as efficient. For those one, I was unable to find any reliable information except their own claims about their efficiency. First one, highlight as many times as you can. SPF 50, daily basis, 2 fingers rule, you know the drill. It's very important to use SPF when you're treating hyperpigmentation. Rather often when we talk about hyperpigmentation, it takes months of treatments, whether with home care or professional care. And I want to highlight that you do have to be very patient with this type of issues, and there is no quick solution for this. Take a photo. Take yourself a photo in some kind of plain environment, and then in a few weeks take another one. Very often when we are fixing our attention to some kind of issue, it feels like there is no change, there is no improvement, but when you see it in a picture, you do understand, okay, maybe this one works. When we talk about post-inflammatory hyperpigmentation, do not touch your pimples, your spots, blemishes, bites, anything. Do not touch it. This will not work very well for you. Make sure that you're soothing the skin and boosting the healing more than everything else when we talk about post-inflammatory hyperpigmentation. Always read the manufacturer's instruction, how to apply it and how to store it. Don't think that you can work very well with a little of the product because you're saving it, because you won't see very great results. And don't think either that if you apply you will see much more results, because this way actually it's much more likely to cause yourself some kind of irritation. Patch test everything that you will use which is new. So you can do it either applying over here, leave it for 24 hours and then see if there is any kind of reaction, or the other way to apply is behind the ear, leave it again for 24 hours. Please stay tuned for the video next week when I will talk about what kind of ingredients you might incorporate into your home care in order to see improvement for your hyperpigmentation. Please like and share the video, subscribe to my channel, and thank you very much for watching.